As nurses, we both know that your shift starts before you even step foot on the unit. What you wear can really set the tone for your entire day, and that is why I love FIGS. Back in nursing school, I remember those boxy, scratchy scrubs that felt like wearing a paper bag. FIGS has changed everything. They make scrubs for people who actually work in healthcare. The first thing I noticed when I tried them on was how flattering they are. You know that feeling when something just fits right? FIGS somehow nails it. And they're not just about looks. FIGS scrubs are antimicrobial to help keep you protected, durable enough for wash after wash, and seriously, some of the most comfortable scrubs I've ever worn. With the holidays right around the corner, it's the perfect time to treat yourself or your favorite nurse to something new for the new year. FIGS just dropped a bunch of limited edition colors and styles, and I already have a few on my wish list. From scrubs to accessories to footwear, FIGS has a little something for every awesome human. If you want to check them out, FIGS is offering 15% off your first purchase at wearfigs.com with the code FIGSRX. That's wearfigs.com, code FIGSRX. Lately, I've been craving cozy looks that are also put together. So I treated myself to the Mongolian cashmere V-neck sweater from Quince in this gorgeous ivory color. I'm already planning all the ways I'm going to wear it. It'll look great with jeans for holiday shopping or paired with a skirt for a more professional vibe at work. It's definitely going to star in my rotation this season. Quince has it all. $50 Mongolian cashmere sweaters made for everyday wear, denim that never goes out of style, silk tops and skirts that add polish, and down outerwear built to take on the season. Perfect for gifting or upgrading your own wardrobe. And by working directly with ethical, top-tier factories, Quince skips the middleman and offers prices that are 50% less than similar brands. So you get that high-end feel without the high-end markup. Step into the holiday season with layers made to feel good, look polished, and last from Quince. Perfect for gifting or keeping for yourself. Go to quince.com/nursemo for free shipping on your order and 365-day returns. Now available in Canada too. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. In today's shorty episode, we're talking about preload versus afterload. So this might be a concept that is brand new to you if you're a student or something that even as a nurse, you're like, wait a minute, what? So let's just go over it really quickly. So looking at preload. Preload, I want you to think of that as the stretch on the ventricle at the end of diastole. So basically, it's how much blood is filling up that ventricle before it contracts and pumps it out, right? So when we look at preload, we're basically looking at volume. If there's more blood coming back to the heart, then preload goes up. And when preload goes up, we have greater stretch on that ventricle. And if you think of the ventricles like rubber bands, like the farther back you pull on a rubber band and then release it, the farther it's going to fly, right? So the more stretch we have on the ventricle, the greater that contraction, the more efficiently that heart is going to pump and cardiac output is going to increase. Now, what if there's less volume coming back to the heart, like in a patient who has dehydration or is bleeding? Then preload is going to go down. And what do you think is going to happen to cardiac output? It's going to go down as well because there's less stretch and a less forceful contraction. So when you think of preload, think of volume. When you think of volume, think of stretch. When you think of stretch, think of contraction force and cardiac output. Now, what about afterload? Afterload is the resistance that the left ventricle has to overcome in order to pump blood forward into systemic circulation. Think of it as the pressure or the load that the heart is pushing against. The fastest or easiest way to remember afterload is to think of resistance. So let's say your patient has their blood vessels are constricted because they are on a medication that does that, like norepinephrine. What do you think is going to happen to afterload? Afterload is going to be higher. So there's more resistance for the heart to pump against. If the vessels are dilated, then what do you think happens to afterload? Afterload drops. And with those examples, we're more or less looking at the left side of the heart, looking at the afterload and systemic circulation, but there can be high afterload against the right side of the heart as well, or that resistance against the right side of the heart as well in a patient with pulmonary hypertension. The right side of the heart, that right ventricle, is trying to push blood into the pulmonary circulation, but that pulmonary circulation has hypertension. So it's harder for the right side of the heart to push into that. And then the right side of the heart has to work harder, and eventually it becomes hypertrophic and you get right-sided heart failure. So preload, volume. Afterload, resistance. So why does this matter? Preload and afterload directly influence how well the heart is pumping, and you're going to see these concepts come into a lot of different disease conditions or pathophysiological conditions like heart failure, shock, hypertension, pulmonary hypertension. And if you know whether the problem the patient is having is with volume or preload, or a problem with resistance or afterload, you can better understand what's going on with them physiologically, why the medications they're getting work the way they do, and have a better picture of your patient and their treatment plan and their clinical presentation. So I hope that helps you understand preload and afterload. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Rinse takes your laundry and hand-delivers it to your door, expertly cleaned and folded, so you could take the time once spent folding and sorting and waiting to finally pursue a whole new version of you. Like Tea Time You. Or this Tea Time You. Or even this Tea Time You.
Said you hear about Dave?
Or even Tea Time You.
So update on Dave.
It's up to you. We'll take the laundry. Rinse. It's time to be great.